Hello everyone, Jamie Gilroy with Shukla Medical. Today I'm here to present some of the product groupings that we talk about on a daily basis. The first one of which being our Shukla Mini set, our Shukla Maxi set, and our Shukla V2 broken and stripped screw removal system. This is a great product grouping to display to every account that's in your territory, certain call patterns, obviously SPD, the OR text, things of that nature. I'm going to talk a little bit about how I present these systems from what I've learned on my own, as well as valuable feedback from all of you in the field. I suggest reviewing this video before you go in to do these calls, because what I'm going to show you in this video is very valuable and will help speed up the purchase of these sets, because we can really illustrate why they're so important to have in their accounts. So the first one, obviously, is the Shukla Mini Screw Extraction System. This is by far the most comprehensive small frag screwdriver set on the planet. Not only are we the most comprehensive, having 21 drivers, an osteotome, which I'll talk about, and then our tremendous broken and strip capability built into this, but we're also far less expensive than everyone else. If you talk about the average Synthes, for example, they charge well over 10 grand for their system. It doesn't even hold a candle to what we sell. So pricing is important, because at $6,400, it's a steal. When I'm showing this system, I always start with a handle. Some of the things you want to point out on the handle are these ridges. These ridges are really important because these surgeons might drive 3 to 12 screws into a plate, and when they're in a fluid-filled field, these ridges help their gloves not slip as they're inserting or extracting these screws. Another thing to point out is our ratcheting. A lot of the other screwdrivers that you'll run into are smooth-handled, non-ratcheting screwdrivers. So fatigue sets in when you're driving a bunch of screws or removing a bunch of screws, and having that ratcheting capability built into the handle itself really helps the surgeons reduce their fatigue and have consistency when they're throwing in these screws. So I like to point out the handle. The next thing I do is I pull a tip. I show the doctor how this works. Simply pull back on the disc, drop your driver in there, and then I just say, "Hey doc, how do you think?" And I'm always handing the doctor the device. I want them to hold it. Doctors are trained to take device, so when you're throwing it in their hand, just throw it in their hand like that. Have them feel it around. Don't ask the doctor if he wants to hold the screwdriver. "Hey doc, you want to try this out?" Doc says no. You're not really going to get anywhere. I always just hand it to them, because when you hand something to them, they're trained to take instrumentation all day, so it's an automatic reaction that they'll take this. So make sure that you're putting this in the surgeon's hand, or in the tech's hand, or even in SPD. All of these people are trained to know quality when they feel it, and ours is high quality. So once I do that, I like to kind of just point out some of the head configurations. "Hey doc, look at all the head configurations. How many times do you have to send a tech out of the room to open up 5 to 10 to 15 sterile trays looking for a screwdriver, when you can simply have this set on hand and have what you need every time?" I want them to recall in their brain all of those times where they've stood in the OR like this, wasting 10, 20 minutes, which at $100 a minute, it's $1,000 to $2,000 a case, and this is happening weekly. Have them recall those times, bring up those pain points, show a solution, and you'll get the sale much easier. The other thing in here that's really, I think, underutilized is our osteotome. As you can see, it has a flat bevel on one side and a rounded bevel on the other, and a pointed tip. So what the doctors will do is they'll use this to remove any bony ingrowth or any debris that's in the screw, because they want to fully seat that driver in that screw. Then what they'll do is they'll take the driver, and because we have this end cap, they'll hammer that in there to make sure they're getting good seating and remove that screw. So point out the end cap, point out the osteotome, and show, if you have a screw. If not, just use your fingers and say, "Hey doc, you can dig out of the well of the screw." And then the other thing that this is used for, and this feedback came from the field, is here's a typical plate. You'll have a plate, you'll get all the screws out, but the plate will have bony ingrowth in and around it, still holding that plate to the bone. So I always say, "Hey doc, you can take this bevel and atraumatically run it underneath that plate to pry that plate off." And the docs really like that capability. So the mini set is really an incredible system. if you know all the little details that really separate us from everyone else. Last but not least important is the broken and stripped capabilities. The smaller the screw, the more often it breaks. So if you're not talking about our broken and stripped capability and doing bone block demos to illustrate just how little bone loss they remove with using these, what's important about bone loss, particularly in extremity work, is there's not a lot of bone to work with. So they don't want a large hole that the Synthes set leaves. They want a very small hole done by our tip that grabs proximally and removes very little bone. So they don't have to use a biologic filler or anything, any damage there. They just grab it from the tip. They're out in seconds and they're moving on with the case. So I really suggest doing that bone block demo and going into full detail on the broken and stripped capability built into our Mini. It's absolutely incredible. And if you get the extremity docs to use this and you get in front of all of them, they'll start buying 4, 5, 6 of these systems and using them in every case. The next system I wanted to review today with you is the Maxi system. Again, we sell a ton of these Maxis. It's by far the most comprehensive large frag screwdriver system on the planet. It's got 18 different head configurations, and then all of these are duplicated into a flexible shaft. So one of the things I start with, again, just like in the Mini, is our handle. We have a square handle, heavily weighted. The docs really like the quality. And then, so the square handle allows for no slippage. And then we have the ratcheting capability built in. Refer back to what they're using now. Hey doc, you have a smooth handled, non-ratcheting system. This is much more efficient. And then we have the quick to attach and the push to disconnect. So you want to point this out because for flow of case, they can easily just insert and move on. And then I showed the flexible shaft. So the flexible shaft really makes a big difference if you're talking to a spine surgeon or if you're talking to a total joint surgeon. So I always illustrate, if I'm talking to a total joint surgeon, that if you're using an elbow joint up in the acetabular cup, you're going to want to switch over to our flexible shafts, have a lot more control and a lot more convenience of getting those screws in or out. So this is why I always tell you to bring this system in. Again, cost is another thing that I always talk about. At $9,800, this is a steal. Synthes charges well over 15 grand for their large frag screwdriver system, where we're at $9,800. They don't have the flexible drivers built in. Their tray is flat to the table rather than upright for easy visualization and identification of the right driver during surgery, along with our Mini has that same capability. So the stand-up system sets us aside. They're always fighting for room on the back table. So this system really is incredible, and when you're showing it to SPD or the OR, it's pretty easy for them to understand if you're going through these steps that we're talking about today. The last thing I want to talk about on the Maxi is just its overall capability combined with the Mini. I'll talk about it every time, cost justification. If they don't have the right screwdriver, which by the way happens every week in every account across this country, it's costing them a fortune. And if you're not talking about this cost, you're really losing the ability to get a quick sale on these. Talk to those surgeons. Say, hey doc, you don't have the right screwdriver. Betty's leaving the room for 10 to 20 minutes. The case is stopped. Your patient's under anesthesia longer than they need to be, which is a risk for everyone, infection, death. They're opening sterile trays that then go down to an already overwhelmed sterile processing department. That's why sterile processing is such a good call point for these three systems, because they're the ones that have a huge pain point. They already have so many trays to sterilize on a daily basis, and then 10 to 15 more come down that weren't even used looking for a screwdriver. And then, $100 a minute and $50 to re-sterilize every tray on average, so the cost adds up. So talk about that as you go through these three systems, the capability that we give them, the cost reduction, the patient safety, the patient outcomes, surgeon frustration, it all adds up tremendously. The last of the three systems is the V2 Broken and Stripped. This is absolutely my favorite system to sell. It's one of the sets that gives us our credibility. I lead with this a lot of times, but when you're presenting the three of them together, just do it in the stages that I've taught you here, the Mini, the Maxi, and then the V2. So the V2 goes up against the Synthes Broken and Stripped screw removal set. Their Stryker has one, and there may be one other out there, but the Synthes is the main competitor out there. The Synthes is a multiple step product that removes a core of bone the entire length of the screw. Most of the time it doesn't work. Most of the time it takes at least 20 minutes to use. And all of the time it takes a huge core of bone. So by taking that huge core of bone, they then have to use a biologic to fill. And it's just a massive time consumption with a horrible outcome. So when we come in here and we say, hey, we've got a broken and stripped screw, you're going to have everyone say they have the Synthes set on hand. It doesn't matter. The Synthes set is worthless in the face of our system. So this is our broken and strip screw removal set, and it's incredibly easy to use. You simply select the tip that you need, chuck it into your drill, and in reverse, you want the doctor to see how fast it works. So get good at taking out these screws out of the bone block, and I always show him the screw, then I always show him how little bone we removed. This is very impressive to the surgeons. They know that what I just did there takes a problem that they've had historically and eliminates the problem altogether. It is super quick, super simple, super easy to use. I always try to also show a stripped example because the stripped is more powerful than just stripping the screw. Even though they do strip screws often, a lot of times, even our systems don't have the right screwdriver. So whether the well is stripped or they don't have the right screwdriver, this threaded engagement will engage the screw. So simply by placing it in and in reverse slowly, you can see how fast that screw comes out and how hard this bites. So I always demonstrate how hard it bites, and I also demonstrate the removal of that screw. That alone gets the interest of 9 out of 10 doctors. The other upgrade that we've recently done are the carbide drill bits. This is a typical plate that you'll find where it has 10 holes. They usually put 8 screws in there, and a lot of times what they'll do is they'll remove a screw, and then one might strip, or one might be cold welded. And if that screw's cold welded, this turns into a nightmare scenario. And this is very often that this happens. So what I suggest is, hey doc, take one of our carbide drill bits, burr the head off the top of the screw, pry the plate off, and then you grab the appropriate size post and go and get that screw out of the bone, and we've just saved you 2 hours and an unsuccessful surgery. And when you can do that, it's very powerful. Working with total joint surgeons is a little different than working with a general surgeon or a trauma surgeon. It's a no-brainer system when you're working with spine, general trauma, but when you get into total joints, they don't really remember that they have a pain point as well. And those pain points lie in Knowles pins, Steinman pins, and many other lag screws that they can't get out. All of this can be removed by these. So if you're not taking out your phone and showing those videos that I've trained you on, you're going to lose the sale to a total joint surgeon. I'll discuss this a little bit more in the total joint breakout and show you those videos to make sure that you have them. But these 3 systems as a whole literally should be in every account that you have in your territory. They save a ton of time. The last thing that I lead with people on is if you have these 3 sets in the room, there's not a screw on the planet that you can't get out. So please make sure that you're bringing these as a bundle. You're showing the attributes of each set, cost justifying along the way, and you're going to make the sale more often than not.